There are nearly 90 million baby boomers in the United States today, many of them facing changes in their vision due to age. In fact, reading glasses are inevitable for everyone after about age 50. It's simply a fact of life. The Near Vision CK procedure is a revolutionary technology using radio waves instead of a laser or scalpel to reshape the eye without cutting or removing tissue. Near Vision CK is an effective and safe alternative for patients who have never had the need for glasses until late in life and who want to improve their near vision.
Since I turned 40 and thereafter, I've had to carry these reading glasses everywhere I go. It's getting real inconvenient.
I think I first realized that I needed glasses probably about age 46. The first time I noticed it was trying to read a map in my car.
I could not read a menu or a price tag.
I would love not to have to wear glasses because the frames get in the way of your vision. They kind of, and they sometimes slide down on your nose a bit.
When you age, your ability to correctly focus light on your retina is diminished. The eye's shape or changes in the eye's function causes light to be focused behind the retina. This is caused by two conditions. The first, called farsightedness or hyperopia, is when your cornea is too flat. The second is called presbyopia, when your lens loses flexibility due to age. Both conditions can make things like reading or seeing your watch and sometimes driving at night difficult. There are a variety of ways people can treat their vision problems. To date, the most common treatments are glasses and contact lenses. But more and more people are choosing surgery to correct their vision and eliminate the nuisance of glasses or contact lenses.
Safety, again, it's a very, very safe procedure. There's nothing invasive about it.
Near Vision CK improves near vision for presbyopic patients. CK has an excellent safety profile and is a minimally invasive alternative to some of the other vision correction procedures available today.
We went on vacation and we did a little snorkeling, and I couldn't see to snorkel because I couldn't see the fish. And I tried you can't snorkel with glasses on.
The perfect candidate for Near Vision CK is someone who is frustrated with his or her reading vision. They have trouble reading the menu in a restaurant or articles in a newspaper. They can't read the label in the supermarket, and they can even have a hard time seeing the food on the plate in front of them. Anyone who is losing patience with their near vision might be a good candidate for Near Vision CK.
I would love to have a procedure that would correct this vision. Having glasses is not the greatest thing in the world, and reading glasses are a real pain because you're constantly on, off, on, off.
CK, or conductive keratoplasty, uses a controlled release of radiofrequency energy, which is introduced into the collagen in the corneal tissue. In conjunction with the eye's natural conductive properties, the temperature of the tissue is increased and the cornea is gently reshaped.
CK is a procedure that I had heard about through our ophthalmology literature.
Near Vision CK provides the ophthalmologist with a sophisticated procedure that is quite simple to perform. Your physician will first perform a complete eye exam to assess your near vision needs and determine if you are a good candidate for Near Vision CK. Once your exam is completed, your physician will review the CK treatment template, or nomogram, and determine how many rings of CK treatment will be required. The procedure involves applying the CK treatment to the cornea. The optical zone marks at 6, 7, and 8 millimeters are used as a template for the treatment application. The physician then begins applying the treatment at the desired optical zone and continues treatment until all rings of the nomogram are complete. The rings of treatment within the corneal tissue create a band of tightening. As the tissue tightens, the central cornea is steepened. The physician continues the treatment, and a few minutes later, the procedure is complete. It's that simple, easy, and non-invasive.
Before CK, wearing reading glasses, I felt dowdy.
The average age of a Near Vision CK patient is 50 years of age. Candidates will generally have had good vision up until turning 40, at which time near or reading vision started to get blurry. Near Vision CK candidates typically do not wear glasses for distance, but need glasses for reading up close. Candidates share a frustration with glasses. They're tired of always depending on them to read the newspaper or their watch, taking them off and on while using their cell phone or the computer.
the effectiveness of the procedure, I've found that it's extremely effective. It does what it promises to do.
Near Vision CK is a simple in-office procedure. On the day of treatment, the patient should be accompanied by a friend or relative, or should make arrangements to be driven home. Prior to having CK, it is important that you talk to the doctor to review any questions you may have.
I understood it to be non-invasive, and that was the key word for me.
Once you are ready, the physician will administer eye drops to numb the eye. You will be asked to put on a surgical cap to cover your hair before entering the treatment room. The patient will be positioned in a comfortable chair. The physician uses an inking marker to gently imprint a predetermined application pattern on the surface of the eye. Within 2 to 5 minutes, the Near Vision CK procedure is complete. After the procedure, additional drops are administered to aid the healing process.
The biggest thing is I felt that it was immediate. I mean, I could immediately see right after the procedure.
Since CK, I can actually read the newspaper without glasses and actually read the fine print underneath the pictures, the captions.
CK treatment follow-up requires several visits to the physician. The exact schedule will be determined on a patient-by-patient basis at the discretion of your physician.
But I feel confident I can pick up anything in the grocery store, read the label, and know that I'm getting accurate information.
I would say probably the thing that it's done for me is it's given me a feeling of renewed youth.
If I could sum up for you what this procedure has meant for me in one word, that word would be freedom.
Near Vision CK, for baby boomers who want freedom from their reading glasses.